Hidden heart crisis. What no one is talking about. Most people believe heart problems are something that just happen with age, a little blood pressure, a bit of tiredness, and we tell ourselves, that's normal, I'm getting older. But what if that's completely wrong? According to new global health reports, more than 2/3 of adults over 50 already show early signs of heart weakness, yet more than half of them have no idea anything is wrong. The frightening truth is that heart disease rarely begins with pain. It starts quietly, in the background, while you're busy living life. Maybe you felt it too. You climb the same stairs you used to run up easily, but now your chest feels heavy. You sit down for a few minutes and tell yourself, I just need to rest. Or maybe you wake up tired, even after a full night's sleep, and think, it's just stress, it'll pass. But deep inside, your heart is whispering for help. The human heart is the most hardworking muscle in the body. It beats more than 100,000 times a day, pumping nearly 2,000 gallons of blood through over 60,000 miles of vessels. Yet we treat it like it's unbreakable. Every heartbeat is a tiny miracle, and every skipped beat, every short breath, is a signal we should never ignore. Doctors used to believe that the main causes of heart decline were genetics, cholesterol, and age. But new studies show something shocking. The real culprit might be muscle loss and reduced oxygen flow caused by inactivity and stress. Think about how modern life has changed. We sit more, move less, worry more. Our grandparents worked in fields, walked miles every day, their hearts constantly challenged, strengthened by daily movement. Now most of us spend hours in chairs, staring at screens, our hearts quietly growing weaker while we think we're resting. A 2023 study from the European Heart Journal revealed that people who sit for more than 8 hours a day have double the risk of early heart aging, even if they go for a short walk afterward. Why? Because sitting slows down circulation. Blood moves sluggishly through the vessels, oxygen delivery drops, and over time, the heart muscle itself begins to shrink. And when that happens, the first symptoms are deceptively small. Cold hands and feet, dizziness when standing up, brain fog, or a feeling that your heartbeat is suddenly stronger at night when you lie down. Tiny clues that most of us ignore until it's too late. Dr. Samuel Grant from the National Institute of Cardiology calls it the silent burnout of the heart. He says, the danger isn't a heart attack, it's the decades of quiet decline that come before it. But here's the twist. Walking, jogging, and even typical gym workouts don't always fix the problem. In fact, many seniors who walk daily still experience heart muscle deterioration. Why? Because those activities often stress the joints more than they strengthen the heart's internal rhythm. They boost pulse temporarily, but don't rebuild the micromuscles that support heart contraction. So if walking isn't enough, what is? That question led researchers at top universities into a completely new direction. Instead of forcing the heart to work harder, they look for ways to make it work smarter, gently, rhythmically, and efficiently. But before we get to that breakthrough, it's important to understand why traditional thinking about heart health may have been wrong all along. For decades, the medical world focused on medication and diet alone. Lower your salt, reduce cholesterol, take pills, that was the prescription. Yet despite millions following those rules, heart disease remains the #1 cause of death worldwide. Clearly, something was missing. Recent science points to a missing link. Muscle-to-heart communication. Yes, your muscles actually send signals to your heart. When your leg or core muscles contract, they squeeze blood back toward the chest, helping the heart pump more efficiently. This process is called the muscle pump mechanism. When we stop moving, that mechanism weakens. The heart ends up doing all the work alone, and over years, it begins to fatigue like any overworked engine. This explains why some older adults, even those who appear healthy, suddenly face unexplained heart failure or chronic fatigue. It's not always blocked arteries. Sometimes it's simply a tired heart. Dr. Anita Roy from Oxford's Department of Cardiovascular Science summed it up beautifully. Open quote, "We've treated the heart like a patient when we should have treated it like a teammate." Close quote. And she's right. The heart doesn't want punishment. It wants partnership. Gentle movement, proper breathing, deep circulation. These are the signals that tell it, you're not alone. The body's helping you. Unfortunately, modern exercise culture often forgets this. High-intensity workouts flood the market, but they're impossible for seniors or those recovering from illness. Even brisk walking can cause pain for those with arthritis, knee issues, or balance problems. So millions give up, believing they can't safely exercise anymore. And that's exactly when the decline accelerates. But here's the hope. Scientists started to notice something extraordinary. In clinical trials, a few older adults who practiced seated, low-intensity movements, gentle leg lifts, rhythmic breathing, and arm rotations began showing stronger heart performance than those who walked daily. One pilot study conducted at the University of Toronto found that after just 6 weeks, participants who performed 10-minute chair-based routines increased their cardiac output by 27%, even though they never stood up once. This discovery shocked the medical community. Could the solution to heart aging really begin in a chair? It sounded impossible until more data came in. By 2024, similar results were replicated in clinics in Japan, Germany, and the US. Each time, the outcome was consistent. Calm, focused movements that improved circulation and oxygen exchange restored heart vitality faster than conventional walking programs. It became clear. The future of heart health wasn't about running marathons. It was about teaching your body to move again from the inside out. So if you've ever been told you're too old to exercise, or if your doctor said just walk more, but walking leaves you breathless, there's finally another path. Because just a few months ago, researchers at Harvard Medical School announced a method that's transforming senior fitness around the world. A method proven to rebuild heart muscle strength naturally and rejuvenate the cardiovascular system without strain or medication. And in the next part of this video, we'll reveal exactly what that discovery is, how it works, why it's so effective, and the 5 simple chair movements that can help you start reversing heart aging right from your living room. How modern science is retraining the heart to heal itself. In late 2024, a quiet revolution began inside a Harvard Medical School laboratory. A team led by Dr. Elena Marquez, a cardiovascular physiologist with 25 years of research behind her, published a study that stunned the medical world. Her question was simple. Open quote, "What if the human heart isn't failing? What if we've just forgotten how to train it?" Close quote. For decades, cardiology focused on fixing problems after they appeared. Stents, pills, surgery. Dr. Marquez wanted to see what would happen if the body were guided to retrain its own heartbeat, gently, safely, and naturally. Had the discovery. Her team designed a program they called Rhythmic Flow Training, RFT, a combination of seated micro-movements, timed breathing, and low-intensity muscle pulses. No treadmills, no weights, no strain. Just simple motions designed to awaken the forgotten circulation pathways that feed the heart. After 8 weeks, participants between ages 55 and 80 showed results that seemed almost unbelievable. Heart muscle thickness increased by 14%. Resting pulse dropped by 12 beats per minute. Energy levels doubled, measured by oxygen uptake tests. Medication use decreased in 41% of volunteers. Doctors reviewing the data called it cardiac rejuvenation without stress. Dr. Marquez explained, open quote, "We discovered that the heart doesn't just respond to cardio, it responds to rhythm. When movement, breath, and timing synchronize, the heart begins to repair itself." Close quote. That phrase, repair itself, became the headline, because for the first time, science was proving that even an aging heart could regain its youthful power when trained the right way. How it works. Inside the body. When you move your legs, arms, and diaphragm in a rhythmic pattern, the body activates a powerful mechanism known as venous return boost. Tiny muscle contractions push blood upward toward the chest. At the same time, deep breathing expands the lungs, lowering pressure inside the chest cavity. The result? A vacuum effect that draws blood back into the heart with every inhale. This increased inflow stretches the heart's internal walls, just slightly, triggering a process called adaptive remodeling. It's the same natural growth response athletes experience, but achieved here through slow, safe motion. Over time, the heart learns to pump more efficiently with less effort, restoring stamina, warmth, and mental clarity. Dr. Marquez compared it to teaching the heart to dance again. The 5-movement formula. The Harvard program distilled its findings into 5 daily movements, each lasting only 2 minutes. They can be done from a chair, bed, or sofa, perfect for older adults or anyone recovering from illness. Movement 1, the heart pump. Sit tall, place both feet flat. Inhale slowly as you lift your heels. Exhale as you lower them. Repeat for 2 minutes. This gentle calf motion pushes blood upward, stimulating circulation to the core. Movement 2, the chest expansion. Place hands over ribs. Breathe in deeply through the nose for 4 seconds, expanding your ribs like wings. Hold 2 seconds, then release through the mouth for 6 seconds. This improves oxygen exchange and relaxes coronary arteries. Movement 3, arm pulse. With elbows at sides, push your hands forward as if swimming. Each push aligns with an exhale, each pull with an inhale. This engages the shoulder and chest muscles, assisting venous return. Movement 4, core flow. Tighten your abdominal muscles gently as you breathe out. Relax as you breathe in. It's small but powerful. The diaphragm and abs act as internal pumps to massage the heart from below. Movement 5, mind stillness. Close your eyes. Focus on your heartbeat. Imagine your breath and pulse syncing into one rhythm. Research shows this coherent breathing can lower blood pressure in minutes. Together, these 5 moves create what Harvard calls microcardio. Cardio small enough for anyone, yet effective enough to retrain heart rhythm at the cellular level. Proof beyond Harvard. After Harvard published its first paper, other universities rushed to replicate the results. Within 6 months, Tokyo University confirmed a 19% improvement in cardiac output among elderly participants. Stanford's biomedical lab reported that seniors who practiced RFT daily for 3 months showed better emotional stability and deeper sleep. Cambridge Medical Center observed reduced inflammation markers, proof the benefits reached beyond the heart itself. The mechanism was so consistent that the World Health Forum 2025 recognized rhythmic flow training as one of the top 10 innovations in preventive cardiology. Real stories, real change. One of Dr. Marquez's early patients, 67-year-old Daniel Lopez, had been living with chronic fatigue and mild heart failure. Walking even 1 block left him breathless. After 10 weeks of RFT, his resting heart rate dropped from 94 to 72, and he could climb stairs without stopping. When asked how it felt, Daniel smiled and said, open quote, "It's like my heart finally remembered what youth feels like." Close quote. Another patient, Meera Patel, age 74, described it differently.
Real stories, real change 1. Of Dr. Marquez's early patients, 67-year-old Daniel Lopez had been living with chronic fatigue and mild heart failure. Walking even 1 block left him breathless. After 10 weeks of RFT, his resting heart rate dropped from 94 to 72, and he could climb stairs without stopping. When asked how it felt, Daniel smiled and said, "It's like my heart finally remembered what youth feels like." Another patient, Meera Patel, age 74, described it differently. "I used to think calm meant stillness. Now I know calm means rhythm. My whole body moves like it's breathing again." 6. The bigger picture. The implications go far beyond seniors. Cardiologists now believe that RFT-style movements could help prevent heart disease in younger adults trapped in sedentary jobs. Every hour of sitting weakens the microcirculation system. Even 2 minutes of rhythmic motion can reverse that damage. Imagine if workplaces, schools, and homes adopted 2-minute heart breaks throughout the day. Millions of lives could be transformed. This realization is changing medicine itself. Hospitals are shifting from treatment to training, from pills to movement. And technology is following. New wearable devices now track micro-heart rhythm, guiding users through safe patterns of breath and motion. The future of cardiology may look less like a hospital and more like a calm, guided routine at home. 7. What you can do. Starting today, Dr. Marquez's team emphasizes that results appear fastest when 3 daily habits combine. 1 morning activation. Do the 5-movement formula within 30 minutes of waking up. It turns on the circulation system for the day. 2. Hydration pulse. Drink a glass of water every hour. Water carries the oxygen your revived heart needs. 3. Evening. Calm. Repeat. Movement, 5 before bed for 5 minutes. This resets heart rhythm and improves sleep. Follow these for 21 days, and early changes become noticeable. Warm hands, steady energy, lighter breathing, brighter mood. Within 60 days, many participants report blood pressure normalization and better exercise tolerance. It's not magic. It's biology rediscovered. 8. A new definition of heart health. For centuries, we believed aging meant losing strength, but modern research is showing that aging is often just disuse accumulated over time. When we restore movement, even the smallest ones, the body responds with astonishing speed. As Dr. Marquez said at the 2025 Health Summit, "We don't grow old because our hearts weaken. Our hearts weaken because we stop moving with them." The Harvard research reminds us that healing isn't always loud or painful. Sometimes it starts with a whisper, a slow breath, a gentle pulse, a tiny movement that tells the heart, "You're safe to beat again."